2, 3. How are you, Dr. Peter Chin Hong? Did I pronounce your name correctly?
Yes, Peter Chin Hong.
May I call you Peter?
Yeah, of course.
Yeah. Dr. Peter, did the outbreak of the Hantavirus start because people caught the Peruvian virus in Argentina or Chile, where it is common, or did the virus then spread from person to person on the cruise ship rather than from rodents? Your thoughts?
Yeah, so in the beginning, before we knew much more information, there were two possibilities. One is that people got it from infected rats on the boat through droppings, which is the usual transmission route. But over time, because of the identification of the Andes virus, this is most common in South Argentina and Chile. And it's thought that the Dutch couple acquired it first when they were bird watching close to a landfill or a garbage dump, where there are probably a lot of rats infected with this virus. And what likely happened is they inhaled some of the dust with feces or urine from the rodents that were infected, didn't have symptoms, went on board, and then spread it to other passengers.
Thank you. Thank you very much. Now, is this outbreak as serious as COVID-19? What is hantavirus exactly? And is it as deadly as COVID-19?
Yeah, so hantavirus is a virus. It's not as common in the Americas or in the United States. We probably get about 30 cases a year in the US, 3 cases a year in California, about 300 cases a year in Argentina. But around the world, in Asia and in Europe, you may get hundreds of thousands of cases, but it's a different kind. The one in the Americas, United States, South America, is more deadly, with about a 40% fatality rate. In Europe and Asia, the hantavirus you get there is less deadly, with a fatality rate of about 15%. It will likely not be the next pandemic, even though the number seems so high with mortality rate, because it's really hard to get. It's not meant to go from person to person. It's really best transmitted from rat to person. There is a long incubation period. When people don't have symptoms, they don't usually spread it. People spread it more when they have symptoms. And they get sick once they have symptoms very fast. So they're not out and about spreading infection in the community. So there are many reasons why we think this will not be the next COVID.
Well, we know that viruses also evolve and evolve rapidly. So would you say that there is a possibility that they spread from person to person? Is a possible outcome?
So that's a great question. So COVID-19 mutates very quickly. Even flu changes from year to year, but hantavirus is very stable in general. In fact, they did some initial analysis of this strain already in South Africa, and it shows that there were no new mutations from what we know about the Andes virus from before. So we don't think it will act any differently and not lead to new modes of transmission or increase person-to-person spread. When somebody is symptomatic from hantavirus, that person can infect 2 other people from this particular strain, Andes virus. When somebody has measles, you can probably infect 10 other people who are unvaccinated.
So to clarify, is the Peruvian virus, hantavirus, the cause, and is it the only hantavirus that spreads between people?
Yeah, so it's the Andes virus. So it's called the Andes virus, and it's mainly in South Argentina and Chile, some in Peru, but mostly there. And it's the only hantavirus. There are more than 50 different types, 2 major classes or families, one New World Americas and one Old World. But this is the only one of all the hantaviruses that we know can spread from person to person.
Now, this event caused several deaths and forced the ship into quarantine. Are there 9 confirmed cases, 2 suspected cases, and 3 deaths, a Dutch couple and a German national? Do you confirm that?
Yes, so as of this morning, there are now 11 cases, 9 confirmed, 3 suspected. Sorry, let me say it again. As of this morning, there are 11 cases, 9 confirmed, 2 suspected, and 3 deaths.
And in your opinion, is quarantine the best solution at this moment?
So, before people have symptoms, quarantine is a good solution. I think it remains to be said how long someone should be under active quarantine in a facility versus quarantining at home. Different countries are doing different things, but everybody is unified in the thinking that people should be under some quarantine for a total of 6 weeks. Whether or not that's in an observed facility or at home, I think remains to be seen how different countries do it differently.
So this window of 42 weeks, this is a standard window, or is it something specifically to hantavirus?
Yeah, specifically to the strain, the incubation period is 2 to 6 weeks from possible exposure to when you develop symptoms. Most people actually develop symptoms at, I would say before 3 weeks, or day 19 to 23. But 6 weeks is being very careful.
So for those people who actually have the virus and are right now being quarantined, what's the procedure? What happens afterwards? This strain this genetic strain will remain with them, or will be liberated from the body somehow and as toxins? What happens afterwards?
So if somebody is quarantined, that means they may not even be infected, so nothing will happen to them after that period. If somebody has infection and they recover, and this virus has a 40% fatality rate again, and it doesn't linger in the body, you don't get a long COVID-like symptom or disease, you'll be cured.
Is it deadly or not? You have to be already with a precondition.
No. In all comers who get this kind of in all comers who get this kind of hantavirus, it is quite deadly at around 40% fatality rate. So you have a 40% chance of dying. If you have access to a intensive care unit that can support you, the risk of dying is much lower.
However, this 40% chance of dying is correlated to pre-existing conditions. So you have problem of asthma, or you have some other kind of symptom. Is this correlation real?
We don't know for sure because it's so rare, but yes, I would assume that if you're older, have comorbidities, if you're immune compromised, that you have a higher chance of doing poorly, because what happens is that your lungs just get full of water and it's almost like you're drowning. So if your heart isn't working well or your kidneys aren't working well to begin with, you probably have a harder chance of recovery. So that makes sense to me.
Thank you. Very, very insightful. Now, is the chance of getting hantavirus actually low? And did the CDC, the Centers for Disease Control and Prevention, give advice and recommended 42 days of monitoring for people who were exposed? So they are involved closely with these cases?
Yes, I think the CDC did the right thing. It is for the right length of time that people are recommending quarantine for people who have no symptoms, who are exposed. I think it's also right to consider that anybody on the boat is a close contact because of the close quarters of the boat. So yes, I think the response is very appropriate.
Thank you. Now, the end of our interview. What are your tips to prevent outbreaks, Dr. Peter, and how can people avoid catching or spreading the virus? Do hand washing and wearing masks actually help?
Yeah, so the single most important thing to do to prevent infections, particularly if you're on a boat, is to wash your hands thoroughly and frequently with soap and water for about 20 seconds, especially before and after you use the bathroom. It's better to use soap and water than hand sanitizer because hand sanitizer doesn't get rid of some gastrointestinal diseases like norovirus, which can be common on boats. The second thing to do is to stay up to date on your vaccines. Try to get them 2 weeks before travel. The third thing is report illness promptly to the medical center on board the ship if you get even mild symptoms. The fourth thing is to stay away from others if you're sick. And the fifth thing is to follow good food and water safety practices if you're going to visit ports of call if the ship docks somewhere. Stay away from rodents, ticks, mosquitoes if you can, or use repellents for that.
Thank you very much. Very, very, very good. And now your final remarks. And is the United States prepared for another outbreak?
I think after COVID, we all got tired and fed up with taking or following public health precautions. I think this outbreak right now that involves multiple countries shows that we can get together when we can, but I still think there's a long way to go. We've contributing less to global health now from the United States. We've decreased funding by about 70% within the last year. And we need to continue to all work together. We're all interconnected. And prevention is better than cure.
Thank you so much. Thank you.